Yes, they are inspiring. Prince William County, Manassas, and Manassas Park need the coverage gap in Virginia closed. This would provide health insurance to adults whose income falls below 138% of poverty. This is what Medicaid expansion or a private sector alternative would achieve. The greater Prince William area has much higher percentages of people who are uninsured than the other counties and cities in Northern Virginia. Not surprisingly, the two hospitals in our area, Novant Prince William and Centera Northern Virginia, when compared to the other Northern Virginia hospitals, have very high use of their emergency departments, often for health problems that are not emergencies. And far higher proportions of their emergency department patients are uninsured. Most of these uninsured emergency department patients are working with barely subsistent incomes. The two hospitals provide care in the emergency department free or at substantial discounts to those with limited incomes. These costs have to be passed on to those of us who are insured. Those who are uninsured get episodic or catastrophic rather than comprehensive health care. And local businesses and individuals buying health insurance pay higher premiums to cover these costs. As a nurse midwife, it appalls me that Manassas Park, Manassas, and Prince William have the three highest percentages in Virginia of pregnant women who have no prenatal care before they deliver. Just a few years ago, more than 10% of the women in Manassas Park and Manassas received no prenatal care before they delivered their babies, while less than 1% of other Virginia women went without prenatal care. We at the Greater Prince William Community Health Center and the Ridgewood Health Center here and at our new Evergreen Health Center on Liberia Road in Manassas now provide care to many of these uninsured residents of the Greater Prince William area. Already the percentage of pregnant women with no prenatal care has decreased. About 40% of our patients are insured, but the vast majority of those are insured only during their pregnancy. Those people with Medicaid expansion would also be insured both before and after their pregnancy. In other words, all the time. The positive difference this would make to both their lives and the lives of their family members is incalculable. And I say that as a medical provider, intimately familiar with many of their life circumstances. Many of these people enter care during pregnancy with undiagnosed pre-existing conditions like hypertension, and diabetes, and thyroid disease, anemia, and many other conditions that they receive no care for before their pregnancy because they only have insurance for the pregnancy. And we have a window of time. We have 6 months to take care of their hypertension, take care of their diabetes, and then 60 days after their babies are born, we have to send them out in the world again without insurance. As I said, about 40% of our patients are insured, but that means 60% are uninsured. Nearly all of those are below 138% of the poverty line, the income level for providing insurance through Medicaid expansion or private sector alternative. Again, the positive impact on their entire families would be incalculable. Those uninsured patients pay a portion of the cost of their care here at the health center. But even with those partial payments, there's a large hole that we have to fill with gifts and grants and donations to keep our doors open. We provide outstanding quality care here with great outcomes for women who go through our Centering Pregnancy program. We have the highest level designation as a patient-centered medical home, but we do not have the capacity or the funds to provide care for everyone in these areas who are uninsured. Expanding Medicaid and closing the coverage gap would thus measurably improve the overall health of the local population, move a significant amount of patient care from expensive emergency room settings to more supportive and moderately priced settings, lower health care premiums paid by local businesses and privately insured individuals, allow both local community health centers and rural hospitals to provide greater levels of high-quality health care to the most vulnerable members of society without the constant threat of closure that looms above all of them. We would benefit all Virginians by helping to ensure that they live in a place with healthier people, all of whose lives and futures are valued. We in Prince William, Manassas, and Manassas Park need this.